Hello everyone, my name is Michael Duhig, and today I'll be talking to you about the prevalence and correlates of childhood trauma in patients with early psychosis. Why examine this relationship? Well, as we know, approximately 1% of the general population is affected by psychosis in a severe and debilitating way. As such, the research team and I wanted to look at a modifiable risk factor for psychosis. Childhood trauma was first proposed as a causative risk factor by John Reid in 2005. He concluded that childhood sexual abuse was associated with more severe positive symptoms in an early psychosis sample. Moving forward to our study, we wanted to A. establish a prevalence rate of those exposed to childhood trauma, and B. look at the correlates of those exposed to childhood trauma and compare them to those not exposed. We did this through 4 outpatient clinics across southeast Queensland, at the Royal, at the Princess Alexandra, at the Prince Charles, and also at the Gold Coast Hospital. We use those measures listed there. The PANS looks at positive and negative symptoms of psychosis. The DAS, I'm sure you're all familiar with. The APQ6 looks at social and vocational functioning. We also had a substance use measure, and we also obviously looked at childhood trauma. In our sample, we found that there were some gender differences. We can see there that emotional abuse was more likely to be endorsed by females compared to males. Similarly, females were more likely to be exposed to childhood sexual abuse compared to males. No other significant differences were found for those other types of childhood trauma. Total Ctq score, so this is a summation of those 5 different traumas listed previously. We found that this score was significantly correlated with positive symptoms, depression and anxiety. Contrary to hypothesised, we found that there was no correlation with substance use or social or vocational functioning. Limitations. All studies have limitations. Ours had the limitations in that it was quite a small sample size of 100. We didn't have a control group to compare these results to, and this was a retrospective report of childhood trauma. Despite these results, we found that childhood trauma is very prevalent in EP patients. We found that 82% of our sample endorsed at least one type of childhood trauma. We also found that females were more likely than males to be exposed to emotional and sexual abuse. We also found that those exposed to childhood trauma were more symptomatic in relation to their depression and their anxiety. Clinical implications. So, before we start these, it's important to ascertain whether or not this patient or this client has been exposed to childhood trauma. After this has been established, then this can inform whether you engage in trauma-informed care for those that did endorse it, or whether you progress with standard care. With those that are exposed to childhood trauma, trust and the therapeutic relationship is vital, and this needs to be established early on. Similarly, post-traumatic symptoms as well as depression need to be treated in line with the psychotic symptomology that is treated by these outpatient clinics. Thank you very much.